Introduction to Data Breach and Loss of Patient Health Information. Health information, privacy, and security regulations have changed a great deal since 1996, when HIPAA was first written into law. The HITECH Act, adopted during ARRA in 2009, required HHS to strengthen the privacy and security protections, specifically as it related to electronic medical records. This means fines and penalties for the loss of PHI are very severe, and the procedures for remediation are more onerous. You and/or your medical practice are at risk in a variety of different and unique ways. 1. Lost or stolen records include paper, disks, flash drives, and laptops. 2. Poor records management. 3. Disgruntled employees. 4. Hackers, especially in the case of high-profile clients. 5. Business associates and agreements that are insufficient. 6. Inadequate segregation of duties. An interim final ruling was issued by the government on 9/23/09 that changed the enforcement criteria. Below is a table that illustrates various fine and penalty amounts. If you are like most medical providers, you have either fully implemented EMR or are doing so now. The transition to EMR is great for a variety of reasons, but puts you at greater risk of losing PHI. Furthermore, most practices have forgotten to implement the technical, physical, and administrative safeguards that HIPAA HITECH mandates. See below for a list of information that constitutes patient health information. HITECH mandates are many. First, it is important to understand what constitutes a breach and when there is a duty to notify patients. HITECH mandates that you notify patients involved in a breach no more than 60 days after the breach occurred. A brief description of the breach, including the date of the breach and the date of discovery, must be included. There are a number of other requirements that are listed on this page. In the earlier slide, we discussed the details of notifying a patient of a breach. Unfortunately, the government must also be notified of breaches involving less than 500 records, no later than 60 days after the end of each calendar year. For breaches involving more than 500 records, the steps you must take are more involved. Breaches of electronic patient health information usually don't happen in small increments. With the days of paper records in the rearview mirror, medical providers must realize how simple and easy it is to transfer thousands of records in just a matter of seconds. Theft and loss represent 67% of large-scale data breaches. Paper records only represent 20% of breaches that happened in the last year. The growing use of laptops and other portable devices are driving these numbers. The pie chart represents breach by type involving over 500 records. The largest type of loss is theft, followed by unauthorized access and loss. Hacking incidents represent 6% but are expected to be on the rise. A recent article stated that the Russian mob has shifted its focus from other types of crime to stealing patient health information. The pie chart represents breach by location involving over 500 records. The highest frequency of PHI losses occur through unprotected, lost, or stolen laptops. This is followed by the loss of paper records, which is expected to be on the decline with the rise of EMR. 14% of losses are blamed on portable electronic devices. We discuss the action steps that must be taken in the case of a large-scale data breach. 1. Consult legal counsel. 2. Hire a forensic investigator. 3. Consult a public relations firm and develop a communication plan, notification letter, public notice, and news release. 4. Hire a mailing house. 5. Hire a phone service to implement a toll-free number along with a call center. And finally, 6. Hire a company that specializes in credit monitoring. The chart represents the potential impact a data breach can have on your practice. The number one impact is the diminishment of your brand or medical practice name. Practices that experienced a breach also reported a significant loss of time and productivity and loss of patient goodwill. All of these factors will have a severe monetary impact on your practice. Business associate agreements are not a mainstream name amongst most medical practices. However, they are a fundamental part of securing your patient health information. Not only must you be sure that your medical practice is compliant with the technical, administrative, and physical safeguards of HITECH, but you must also ensure that your business associates, as defined by HIPAA, are compliant as well. Business associate liability flows to all subcontractors that have access to your patient health information. Here is an example of HIPAA's business associate agreement. A copy can be found at www.hipax-ins.com. We discussed earlier how the transition of EMR may lead to more lost or stolen records. HITECH and EMR leaves you with two essential options for protecting your information. Encrypt all of your records, which can cost tens of thousands, or be prepared by partnering with a firm that will ensure your compliance with the technical, administrative, and physical safeguards of HIPAA. This presentation does not cover the following areas with respect to PHI and HITECH. I'd like to ensure your compliance with HITECH. Since implementing all of the measures we discussed earlier would take additional staff, lost productivity, and tens of thousands of dollars, in addition to a great deal of frustration, we suggest you learn about our insurance coverage that protects you when you do have a breach. SynGuard is our data breach coverage. Unlike cyber liability, it is specifically tailored to healthcare professionals. Additionally, SynGuard provides coverage for acts committed by rogue employees and data in the custody of independent contractors. HIPAA Secure Now is a third-party vendor endorsed by HIPAA and HCS, working with medical practices to provide risk assessments for security-related risks. HIPAA Secure Now provides a detailed risk assessment that is compliant with the HIPAA security rule